Alhaji Madugani visits his son Muhammad's grave in northern Cameroon. Just 9 months old, his death was part of a spike this year in malaria fatalities that local health officials attribute to foreign aid cuts by the United States. Before the cuts, Muhammad might have been diagnosed by a U.S.-funded community health worker or treated at a health facility with injectable artesunate, a life-saving drug for severe malaria paid for by U.S. funds. But that drug is now in short supply, and when Muhammad arrived after burning with fever for 3 days, the health center had none to give out. He died that day. I don't want anyone else to ever catch malaria, Muhammad's father Ghani says. Reuters traveled to northern Cameroon to document how the sudden aid cuts are contributing to delayed malaria diagnoses, inadequate treatment, and a growing number of deaths. This story is based on interviews with more than 20 doctors, nurses, community health workers, residents, and former U.S. officials involved in malaria programming. For nearly a decade, the U.S. played a leading role in northern Cameroon's malaria response. But upon taking office in January, U.S. President Donald Trump paused all foreign aid, including the President's Malaria Initiative, or PMI. Launched in 2005, PMI is credited with helping save over 11 million lives and prevent over 2 billion malaria cases. It made Cameroon a focus country in 2017, and recorded malaria deaths in the far north dropped from a little over 1,500 in 2020 to about 650 in 2024. A limited waiver issued in February allowed life-saving work on malaria to continue, but PMI's 30 partner countries, most of them in Africa, have reported major disruptions linked to the closing of the U.S. Agency for International Development. PMI once funded half of all community health workers in Cameroon's far north, says Jean-Pierre Kidwang, the coordinator of the Far North Technical Group for Malaria Control. Kidwang says available trends indicate malaria deaths are rising sharply, though official data has not yet been released. The effects of the cuts have been felt in a number of African countries. Anne Lin, a former senior community health advisor for PMI, told Reuters that before January, PMI supported 115,000 community health workers across 30 countries. That all disappeared, she said, although it's unclear how much funding has since resumed. Trump has said the U.S. pays disproportionately for foreign aid and wants others to pay more. Between 2010 and 2023, the U.S. contributed an average of 37% of malaria program funding, the World Health Organization, or WHO, says. The U.S. canceled more than 80% of aid contracts this year, but said life-saving work, including for malaria, would continue. But organizations on the ground and the WHO have said critical gaps in the malaria response remains. A State Department spokesperson said in the future, it would provide support to fight malaria through bilateral agreements with partner countries, and committed to maintaining 100% of current U.S. funding for commodities, such as nets, drugs, and frontline health workers in fiscal year 2026, before asking governments to co-invest. They declined to give their current annual budget.